Welcome back. So, in this series, let's see what are the differences between the spinal and epidural anesthesia. Many a times, this could be a confusing area. What is spinal? What is epidural? Where spinal is used? Where epidural is used? So, let's see in general, there are three major differences between spinal and epidural anesthesia apart from the location. So let's see that. So spinal anesthesia involves injecting anesthetic drug into the cerebrospinal fluid. Shortcut, you understood this? If not, then go back and see the regional anesthesia picture where you were standing on the left side of the patient. So you are using the anesthetic agent and putting that anesthetic agent directly inside the dura or cerebrospinal fluid. So once you place the anesthetic agent there, the entire lower region of the body gets knocked off. Okay. In epidural anesthesia, here it involves injecting anesthetic drug into the epidural space. As we explained, there is a location difference. Where the anesthetic agent is placed is very important to understand the spinal versus epidural anesthesia difference. Okay. That particular figure which I showed you earlier will be something which will give you a visual impression of the difference in here. The spinal doesn't use any catheter, while in case of epidural anesthesia, we will have medication that will be passed through catheters. Remember, we saw a plastic catheter there in that particular figure. It's a very tiny catheter where that particular catheter is used to give all kind of anesthetic agents. In spinal anesthesia, it can be used for lower limb and pelvic surgeries, while the epidural anesthesias, these are used for the again same lower limb and pelvic surgeries and child deliveries. So if you're talking about anything below belly button, the any of these can be used. Any of these procedures, anesthetic procedures, can be used for below umbilicus pelvic anatomy procedures. Okay. Now, epidural is majoritarily used in case of a childbirth, obstetrics, cesarean sections, all those for which epidural anesthesia is used. So that's pretty much in this session. I'll see you in the next one. Thank you. Sedation, you're just knocking off patient minutely, meaning do not require